Hi, everyone. It is my pleasure to welcome you again to another episode of the Big Picture series of Candid Conversations, courtesy of Iron Pillar, where we interview or just have a conversation with our portfolio company CEOs, as well as members of the Iron Pillar Network and other industry luminaries. So today, it is my honor to welcome a very dear friend, Catherine Mohr, along with her cat, who might pop up from time to time. Yes. Catherine, thank you so much for making the time, and it's a delight to have you. Thank you for your endorsement by being part of the Iron Pillar Network. So I would love to start out by just having you take us through your remarkable journey.
You know the beginning of it, because we met back at MIT when we were both building and racing solar cars. So I started out in engineering and always thought that I was going to be a professor and just going to do the PhD all the way through and become the professor. But I really enjoyed building and racing cars, and I decided to sort of run away and join the circus. So I moved to Southern California and started working with Paul McCready, the father of human-powered flight and who we'd raced against in Australia. And I built hybrid electric off-road vehicles, electric cars. This was the company that produced the Impact, which became GM's EV1, sort of the early seminal work in electric cars. And then I built fuel cell systems for high-altitude aircraft. So we had altitude records with these semi-eternal solar planes. And then I went to medical school, which...
Of course, which one does.
As one does in the middle of all of that. But for me, it was an interesting shift that was the result of quite a bit of soul searching. And I did not like being the manager of people who were managers of people who did what I'd originally gotten into engineering for. And the real deep systemic analysis of things was where I was happiest. And the body is the ultimate machine. And being able to tinker with the ultimate machine and figure out how do you bring technology and healthcare together was why I ended up going to medical school in my 30s. And, all in. And so I trained in surgery, but ended up realizing that I had a lot more leverage. I started a company, if I didn't practice as a single surgeon. I started a small company while I was in medical school. And by the time I was graduating, more patients had had surgeries with the small product that our company was producing than I would ever touch in an entire career. And I'd also designed some surgical procedures for the Da Vinci surgical robot. And by the time I was graduating from medical school, more people had had that surgery that I had designed than I would ever treat as an individual surgeon. So I had this realization that I would be in a much better position to touch many, many more lives if I was back in industry, but really bringing technology and medicine together. So that led to my career at Intuitive, where Intuitive Surgical, the Da Vinci surgical robot, where I developed a lot of the technologies that went on to the robot. I wasn't there for the really early days of the company, but also did a lot of procedure development for it. And then eventually led me to international strategy, which is how I first got to work in India, where we decided we were going to go direct in India, and that was the best way to do it in that market. And I built joint venture in China as well, thinking about how do we bring medical technology into these larger international markets. And now I run Intuitive's foundation, so looking at how we support research all around the world in surgery and technology.
Wow. So going back to this transition to becoming an MD and then designing surgical procedures, was there ever this sort of epiphany of not just scale, being able to, perform N number or 10 or 100 times the number of procedures you would be able to, as an individual surgeon, through technology. But was there maybe an impact angle to it where you said, let me bring something that, parts of the world may never see otherwise? Was there that aspect that was also playing, within you at the onset, or is that something that came later on once you joined Intuitive?
I would say it probably came a bit later on. I mean, I'd always had a little bit of a saving the world complex because initially we were going to save the world with electric cars and, help deal with climate change and put electric infrastructure. My pivot to medicine felt much more turning from a global to a more local. I have a local effect in that I can treat this one person. And where I was in my career at the time, that felt right. My expansion of my view came again as I started to really understand the power of educational technologies, the power of, when I was working with medical schools in India, how few fellowship training slots there were and what we were going to need to be able to do to meet the demand of healthcare and the need for surgeons, with 300 million people entering the middle class in the next 10 years in India. That there was this infrastructure issue, and education was part of that infrastructure. So it was during that period of time that just how much exponential leverage one could get when one started looking at these really fundamental technologies like education, being able to build an AI coach to take someone through a procedure. This is where my view got a whole lot more expansive.
But just pivoting a little bit, so, you talked about, of course, incredible sort of professional experience and then recently transitioning to Intuitive Foundation. What triggered that, and what's perhaps the mission of the foundation, if you can, spend a few minutes on that?
Yeah, so perhaps I'll rewind a little bit to my role in strategy, because I spent 3 years as the VP of strategy for Intuitive. And my role was really to think about what happens when you plunk a big piece of capital equipment into the middle of a system. It perturbs that system. It changes the way surgeons are treating their patients. It changes the finances of the hospital. It changes referral patterns. It changes government policy. It changes it's got effects that ripple out well beyond just the individual piece of equipment. And although as humans, we're all more or less the same from the skin on in, the healthcare cultures that we all exist in, the way in which healthcare gets paid for, the way in which you find healthcare, the way in which you have been, the way in which you accept guidance in that space are all very, very culturally affected. And so perturbing healthcare systems around the globe has a very different behavior depending on what kind of healthcare system and what culture you're perturbing it within, and how that system is going to resonate. So this was fascinating to me and led me to really start building models of what were the parameters around building these big pieces of capital equipment and changing these healthcare systems and modifying these healthcare systems by bringing these pieces of equipment in. But that's what led me to really looking fundamentally at what's the infrastructure. You take the infrastructure of built hospitals and a pipeline of surgeons for granted in the United States. But you get to India and you look at the drawing board for Narayana Health. They're planning to build 100 hospitals in the next 5 years in different tier 2 cities. And you can build a hospital in a year, but it takes you 10 years to train the surgeons to get into that hospital. And so while the work I'd been doing in strategy was very exciting and very satisfying, I started to realize that there were some really much more fundamental infrastructure things that, in order for these healthcare systems to grow, needed to be addressed. And so I began to want to move further downstream towards how do we address some of these infrastructure issues? How do we address educational infrastructure?
Mm.
And it was my desires in that space that led me to put the foundation together. This was the right time for Intuitive Surgical. There's a lot of advantages to having a foundation. There's a lot of disadvantages to having a foundation in terms of complexity and things like that. But it gave us some freedom to pursue things that had like a 30-year time horizon over which they would pay out. And to build some of these more fundamental things that will end up having enormous leverage downstream, but they're not going to pay you off on the time horizons of a for-profit company. And so my desire to really get into the nitty-gritties of being able to bring my time horizon beyond that of a for-profit company led me to saying this is the next correct step for me. And that's led to the Global Surgical Training Challenge, which is my big flagship challenge this year, where we're looking at creating educational modules for low and middle income countries. All of the PIs in the challenge are from a low or middle income country. It's being led out of India and Africa and South America and Central America. And we're building training modules that are relevant to the countries in which they're in and can help address some of these educational issues.
So talk a little bit more about that. So is the intent then to train local surgeons, therefore, through this foundation initiative, or is it something else, especially with the local PIs? Is using them as ambassadors for Intuitive's more broad or the foundation's broader mission?
So the broader mission is to help address the global burden of disease through technology and education. So you'll notice it doesn't say anything about robots in there.
Got it. Yeah.
And so, yes, the broader mission, like I said, is this longer time frame. If you want the crazy, wide-eyed view of what I want this thing to be long-term, is I want to create a nucleus around which open source, freely available, incredibly high quality educational material can be created for surgical practitioners. So that means nurse practitioners and house officers and people who do surgery who are not necessarily called surgeons, but there's a lot of surgical practitioners out there, so that they can learn a new skill at any point in their career and be able to assess themselves and get to confidence and competence so that they can do these procedures well. And so it doesn't, clinically. So we assume that an orthopedic surgeon will never need to do a C-section, or that a nurse midwife will never need to set a bone. And we build into our medical educational systems sort of tracking these practitioners into these silos.
Yeah.
But depending on where you are, you may end up being everything. But if you're trained in one of these disciplines, you have enough raw material to add these other surgical procedures, but we have no mechanisms for doing that in the way traditional medical education happens. So my radical idea is that don't overthrow medical schools, don't overthrow nursing schools, continue to train people, but let them continue to add to their skills once they go out and are beyond the traditional medical school, and to be able to do it in a way that serves the needs of patients out there.
All right, let me dive a little bit deeper, I guess, in the intuitive journey itself to see if I can glean some nuggets of wisdom. Were there times, and I'm sure there were, when there were challenges, the forks on the road, whether it's around entering a new market or it's thinking about, capex versus opex in price sensitive geographies, India among them. What are some of the challenges as you were running strategy for those 3 years that you faced, and to the extent that involved, whether it's a product market fit, a go-to market? I'll let you opine, but just talk about what kept you up at night during those 3 years.
India it was a very interesting learning ground for me. Intuitive Surgical's traditional model had been very, the capital price was the price. It was inflexible. There was no wheelery dealery stuff that was being done. And the instruments had a price. And there was no flexibility on that price whatsoever. And every multinational is going to face this, which is if you try to do regionally specific pricing, you unlock a huge amount of counterfeiting and people ordering things in one place and shipping them to another. You end up having a nightmare. So you've got companies that try to create regional pricing by not allowing products to work across borders. And so when they come across, but everyone has to try to figure this out, because the reality is that not every part of the world that could use your product can afford to pay for it what a rich country can pay for. And you can't viably continue to drive your innovation engine if you bring your global pricing down to what the poorest country can afford. And so the question that I was really struggling with when I went to India is, how do you make it work in India, where the prices that people can pay for surgical procedures are very small compared to what these instruments cost and what the amortization costs. The big insight was what does India have that no one else has? And it's volume. And so a lot of the pricing models, which look at the overall lifetime revenue coming from a system, are built on, well, the system only gets run a certain number of times per day because of, in Europe, because of labor rules, in the United States, because nobody is going to do surgery overnight, all of these sorts of things. But there were some big aha moments in that there was such need in India that you could book and keep a system busy all the time, because there was just this endless line of people waiting for a particular procedure. And if you could make doing that procedure faster, or you could, that people would stay in the hospital less long, so it would free up a hospital bed, so it would allow more flow through, that you could start to think about the capital in a way that was very India specific, and that you could look at less pricing per procedure, but you could optimize it for revenue over the lifetime of the product by working with the Indian system instead of against the Indian system. And it was the insights that came out of that ended up becoming our global program, which is called AMP, and where the company contracts with a hospital or a group of hospitals and places all of the systems very early on, much earlier than the hospital would ever have been able to build all of the capital in order to buy. And then you work with the hospital to get them really up to speed, and to do operational efficiency work with them and make sure that they can get the absolute most out of their system. So they're happy because they're getting super high efficiency out of their systems. They're happy also because they got 10 robots in the year instead of having to wait 10 years and adding one robot every single year. And Intuitive is getting better lifetime revenue from each system that's getting placed, but not upfront capital. So,
Right.
so you have to convince an organization that's had an inflexible pricing structure to build a pricing structure around lifetime revenue.
So look, as we come to the tail end of our conversation, I guess a couple of things. One is any nuggets of wisdom around startups that may be listening to us talk here. What are maybe one or two specific pieces of advice that you would give startups? And again, many of these are companies or startups or entrepreneurs who are building from India for global markets. And maybe if you can weave in, given that you have some experience or maybe significant experience with India, do you find the intellectual capital and the attitude, this sort of aspirational, dream big kind of an approach to building companies from Indian entrepreneurs or people that you've interacted with in India, whether they're hospital entrepreneurs or folks who've built healthcare institutions in India or otherwise?
Wow, there's a lot in that question. So the advice, well, let me start with the last one first, which is you said Indians as a group are the most like bargain hunting, price
sensitive species.
Yeah,
yes,
price sensitive. I also think that there is a streak of entrepreneurialism in there that is just a mile wide. And it has to do with this sort of systemic problem solving when not everything that you need to do, everything that you need in order to move something forward is available to you. There's a huge amount of innovation in workarounds and being able to make do with some of these things. So we get kind of lazy. You can start a company in Silicon Valley with only 4 people in it, even if it's a medical device company, because you can pull in regulatory consultants and you can pull in, contract manufacturers and all of that sort of thing. But you gotta make it all from scratch, and sometimes not always with the ideal thing available, and just the novelty that I have seen in terms of the breadth of solutions. When you think about pressure on systems, that kind of pressure is sort of designed to produce novelty in thinking, and so I see that a lot. And the thing I see that hamstrings some of the Indian entrepreneurs is sometimes it's easier to go international than it is to sell your product in the next state over. Because of octroi and all of the sorts of things that kind of happen, that sort of slow things down a little bit internally. But that, in a way, forcing you international earlier is a good thing. I mean, I see this in my native New Zealand. You can't build a market in just New Zealand. Any product that you're going to make, you've got to be a global company from almost day one. And it pushes a certain kind of thinking. And I see some of that also. Indian companies intend to be global companies from day one. And so they have that right kind of discipline of thinking associated with it.
Well, listen, we have come to the end of our time, and we could go on for hours, no doubt, but it's such a pleasure again. Thank you so much for your time. It's an honor having you as part of the Iron Pillar Network. Thank you, Catherine.
It's a real privilege, and I am looking forward to helping out as I can with your, the companies you're investing in, and looking at all of these things, and building some big leverage.
Awesome.
So, thank you.
Thank you.